general, I think guidelines are intended as guidance documents rather than obligatory documents or regulations. However, there might be instances where it is maybe appropriate to interpret some of the guidelines or recommendation within guidelines as to some extent obligatory, for example, in public health emergencies like Ebola or measles outbreaks. But I think in general they are intended and should be understood as guidance documents. Quality of evidence and strength of recommendation are in fact linked, as you suggested. However, there are other factors that influence the strength of a recommendation, namely balance of benefits and harms, resource use, and values and preferences of patients or populations. And recently the DECIDE project, an EU-funded project, has been completed, which possibly which suggests additional factors that might impact on the strength of a recommendation, feasibility, acceptability, and others. Well, usually the implications of a strong recommendations are, for example, for patients, in fact, that most of the patients should receive that intervention. On the contrary, for weak or conditional recommendations, as we often label them, the majority of patients should receive that intervention, but a relevant number of patients or participants would not receive that intervention. For policymaker, on the other side, strong recommendations usually mean that they really can be implemented, and for weak recommendations, a substantial debate and involvement of stakeholders would be required.